Welcome to This Explainer. Today, we're diving into a massive game changer for UK healthcare. We are looking at the NHS Pharmacy First service. This is an absolutely brilliant initiative, and it's designed to help you completely bypass those notoriously long GP wait times for common, everyday ailments.
Look, we've all been there, right? Have you ever waited over a week to see a GP for something as simple as a sore throat or a really pesky earache? It is incredibly frustrating. You know it's probably minor, but you still need a medical professional to take a look, and maybe you just need a prescription to knock it out. Well, Pharmacy First is the exact solution to that problem. It is a fast-track route to getting sorted, and honestly, the best part, it doesn't require a GP appointment at all.
So what actually is this? Rolled out back in January 2024, Pharmacy First is this NHS service that allows specially trained pharmacists to step up and assess, treat, and even prescribe medications, yes, including antibiotics, for a very specific list of common conditions. And you don't even need to be registered with that specific pharmacy. Usually you can just walk right in off the street. Plus, with your consent, the pharmacist can securely check your NHS record for any allergies or current meds before they do anything, making the whole process incredibly safe and super efficient.
Section 1. The 7 covered conditions.
Okay, let's dive into this. You can't just walk in with literally any ailment expecting a quick fix, so knowing exactly what's on the approved list is going to save you a ton of time. Right now, there are precisely 7 specific low-risk conditions approved for this fast-track treatment. NHS England has definitely signaled they might add more to the list later on, but for today, the magic number is 7.
Now, the details here are absolutely crucial. It's kind of like a strict checklist. We've got acute sinusitis, but that's only for ages 12 and up. Then there's acute otitis media, which is your standard earache, specifically for kids and teens aged 1 to 17. Acute sore throat is covered for ages 5 and older. Infected insect bites and impetigo are both covered for ages 1 and up. Shingles, that's all ages. And finally, uncomplicated UTIs, which is strictly restricted to women aged 16 to 64. Notice those age ranges. They are strictly enforced clinical boundaries. If your baby has an earache but they're under 1 year old, or if a guy walks in with a suspected UTI, the pharmacist simply won't be able to treat it under this specific program.
Section 2. Strict rules and exceptions. So the crucial point here is that walking into a pharmacy under this scheme does not mean you're automatically walking out with a packet of antibiotics. This is a genuine, thorough clinical assessment. Pharmacists are essentially mirroring exact GP practices here. Actually, to put that into perspective, if you go in for sinusitis, they won't even consider antibiotics unless your symptoms have dragged on for 10 straight days without improving. Before that, they're just going to recommend nasal sprays and self-care. For a sore throat, they use this specific clinical scoring tool called fever pain. Since most sore throats are just viral, you're much more likely to get advice on managing the pain rather than antibiotics. For a UTI, you'll need to do a urine dipstick test, and they're looking out for red flags like a fever or loin pain. The big takeaway? Don't be surprised if the expert advice is literally just to wait, rest, or grab something over the counter.
And this beautifully illustrates the deliberate boundaries of the service. It's all about keeping you safe. For straightforward, low-risk presentations that fall within those age ranges, you are in the exact right place. But you will be referred elsewhere for your own safety if you trigger any red flags. Complicated UTIs, like those in men, pregnant women, or children, are an immediate no-go. Sinusitis, but with severe facial swelling, visual changes, or neck stiffness, huge red flag. Same goes for chest infections, a persistent cough, suspected sepsis, or an insect bite reaction that looks anything like anaphylaxis. And by the way, anaphylaxis is a 999 emergency, definitely not a pharmacy visit. A good pharmacist isn't just going to turn you away though, they'll spot these red flags and point you directly to the care you actually need.
Section 3. What does it cost?
All right, understanding the medical side is great, but let's talk about the wallet. What's the damage here? Well, the fantastic news is that the consultation itself is completely free across the board. No charge to chat with the pharmacist. However, for the medication, it really depends on where you live. In England, standard NHS prescription charges still apply to whatever medicine is supplied, unless you happen to be exempt. And those exemptions include being under 16, over 60, pregnant, or in full-time education up to the age of 18. Now, if you live in Scotland, Wales, or Northern Ireland, the whole shebang, both the consultation and any resulting prescriptions, is entirely free at the point of use.
Section 4. Your urgent care alternatives. So what happens if you go to the pharmacy, but your condition hits that red flag list we just talked about, or you're just outside the age range? What's your next move? Think of this like your escalation ladder, moving from lowest to highest urgency.
Step 1 is NHS 111. You can do this online or on the phone, and it is absolutely perfect for getting solid advice or being directed straight to an out-of-hours GP. Step 2 is GP virtual triage. Tons of practices use same-day e-consult systems now, so you aren't stuck on hold at 8 a.m. listening to hold music. Now, if you need a physical exam today, but it's not life-threatening, Step 3 is an urgent treatment center or a minor injuries unit. And finally, Step 4 is A&E or 999. But remember, we are reserving this strictly for true emergencies. We're talking chest pain, difficulty breathing, signs of sepsis like a fever combined with confusion or a non-blanching rash.
Pharmacy First really has been a revolution in how we can bypass those agonizing GP waits for basic, low-risk conditions. But its success, it relies entirely on operating within very clear, very strict clinical boundaries. Getting the right care at the exact right place without unnecessary delays is entirely possible once you've got a handle on how this system works. So I want to leave you with this final thought. Knowing exactly what is and isn't covered by Pharmacy First, how are you going to navigate your next unexpected minor illness? Will you be making the pharmacy your first stop? Thank you so much for joining me for this explainer, and stay curious.